The peak age for an ATR is 30 to 40, with men being 5 times more predisposed to the injury. A month before the pandemic started, I tore my Achilles tendon practicing martial arts. I can tell you, rehabbing from an injury during a pandemic is a whole different level of frustration. Because of COVID restrictions, you need to become much more self-reliant and proactive. I coined a term for compounding injuries I call the cascade effect. It works like this. The push and pull forces of the musculoskeletal system will try to compensate for the original injury, so a significant injury to your foot will eventually affect your knees, which will in turn affect your hips, and so on up the chain. This cascade effect can happen in any order or not at all. But if the injury persists long enough, chances are you will be dealing with other soft tissue injuries by the time the original injury has healed. As a consequence of my Achilles tendon rupture, I developed major bilateral knee pain, which eventually led to hip and low back issues. There is one muscle that I paid special attention to, and training that muscle was a game changer. The often overlooked and definitely underappreciated gluteus medius, and in my opinion, the best hip muscle to train for eliminating knee pain. The gluteus medius muscle contracts to stabilize the pelvis when you're walking. The most important thing you need to know is that the glute med also externally rotates the femur at the hip joint. When the glute med becomes weak, it allows your femur to internally rotate and cause the patella to track abnormally. Eventually, this can lead to knee pain. Many common knee injuries can occur as a result of hip weakness. As a therapist, I see patients suffering needlessly from knee pain that can be fixed by training and strengthening your gluteus medius. Training my gluteus medius has proved to be the most beneficial exercise in eliminating my knee pain. So what's a simple way to train the gluteus medius? My go-to exercise is a side-lying leg raise. It's simple, direct, and it works. So there it is, heavy stoners. If you're suffering from chronic knee pain, I would encourage you to start training your glute med. Let me know how that works for you.